Good evening. I hope everyone is doing well. Today I'm going to do my speech on something that is very close to my heart. Do any of you know what the leading cause of death is in the United States? According to the Center of Disease Control and Prevention, it's heart disease. Heart disease is the #1 killer of men and women in the United States. According to the CDC, more than half of all deaths that occur in the United States are due to heart disease. I'm sure with this being so prevalent that all of you have been touched in some way or another with heart disease and heart attacks in your life. I'm going to tell you now why this is such an important topic to me. A little over 3 years ago, on March 25th, 2010, my husband, at the age of 38 years old, had a massive heart attack. He had what is known as the Widowmaker heart attack. It is when a sudden blockage occurs of the main coronary artery. The main coronary artery supplies the heart with its own blood supply and oxygen, and his became 100% occluded. When that happens, death is almost imminent in every case unless you are in a hospital setting. Luckily for my husband, his heart attack occurred in the ambulance directly in front of our house, so he was able to get life-saving oxygen, aspirin, and nitroglycerin at the very moment his heart attack occurred. The most fortunate part about our story is that I was in the middle of nursing school when he had his heart attack. Weeks before his heart attack, I felt like there was something wrong. I couldn't put my finger on it, but while I was in the middle of cardiology class, I just kept getting the feeling that something was wrong with his heart. I spoke to my professors and fellow students, and some of them thought I was crazy. Some of them told me to go with my gut instinct. My husband thought I was nuts and thought that I was trying to be a doctor and trying to diagnose everyone, which I was. But there were just some subtle things that I noticed, and it concerned me. Looking back now, I realize that those subtle hints were all that we would have had. It's all that we did have. Fortunately, because I was in nursing school, I noticed those subtle things, and I knew when I put those subtle things together what it could mean. If I would not have had the knowledge and the background that I have, the outcome may be different. The doctors, even today, give me credit, and my husband's credit, for the persistence when we insisted that something was wrong with his heart. And nobody wanted to listen to us. They said it was musculoskeletal. They said he was too young. And fortunately, our outcome was a good one, and he's still alive today to tell his story. So this is very important to me, and I'm hoping to educate everyone today on some risk factors of heart disease, signs and symptoms of a heart attack, and some tips of what you can do if you're ever in an emergency situation yourself, or if you're with someone who you fear might be in a heart attack situation. Before I get into some things that I'd like to review with you today, I'm going to show you a little clip. This video that we're about to see gives you an animation of what happens to the heart during a heart attack.
The heart is responsible for pumping oxygen-rich blood to the rest of the body, providing the energy that the body needs to function. The muscles of the heart itself also need a supply of blood. The coronary arteries, one of which we see here, fill that need. Sometimes a cholesterol plaque forms on the side of the artery, reducing blood flow. If part of that plaque breaks through into the artery, platelets tend to attach to it, creating a blood clot, further reducing or blocking blood flow. The blockage in the artery prevents blood from reaching part of the heart muscle. Without blood, the muscle is starved for oxygen, causing damage to the heart muscle. The heart attack occurs because the damaged heart can no longer pump properly.
That video did a wonderful job explaining what happens to your heart during a heart attack. Now that you know what happens during a heart attack, it is important that you know what your risk factors are. Certain risk factors increases the chance of plaque building up in your arteries. If you have any of those risk factors, it's important that you know about them and you try to make lifestyle changes to help reduce the risk of progressing coronary artery disease and a possible heart attack. Risk factors are broken down into two different categories: modifiable and non-modifiable. Non-modifiable risk factors are things that you can't do anything about. Age. Obviously, the older that you get, the more likely you are to have coronary artery disease. Being a male. Family history. And even being African American are all things that make you at an increased risk. Unfortunately, you can't do anything about those risk factors, but it is important to know if you have any of those risk factors to be aware of them so that you can change the risk factors that are modifiable. Some modifiable risk factors for coronary artery disease that you can change are things like your weight, your diet, lowering your cholesterol, following a heart-healthy diet, lowering your blood pressure, getting more exercise, and maintaining a healthy body weight. Some common signs and symptoms of a heart attack are chest pain. The chest pain can radiate down your arm, to your jaw, to your shoulder, and your back. You may have nausea, vomiting. You may break out in a cold sweat. You could feel short of breath. You could feel lightheaded. And you could have a feeling of anxiety or impending doom. I can tell you that in our experience, the only symptom my husband really had was heartburn. He went through 2 bottles of Tums in the weeks before his heart attack. We kind of associated that with heartburn symptoms. His other big complaint was fatigue. He wasn't just tired, he was fatigued, and he was fatigued for no reason at all. You can see how vague some of the symptoms of a heart attack may be. How easy it would be to dismiss chest pain as possibly a pulled muscle. Fatigue, you could chalk that up to our busy, hectic lifestyles. It is important to seek immediate medical attention if you think you might be having a heart attack or someone you are around may be experiencing a heart attack. Time is crucial when you're having a heart attack. The longer a heart attack progresses, the more damage is done to the heart muscle. Knowing what signs to look for can increase your chance of survival. Not only knowing what signs to look for, but knowing what to do in an emergency situation can increase your chance of living through a heart attack. If you are with someone who you suspect having a heart attack, you want to call 911 immediately. You never want to drive them to the hospital themselves. If you have aspirin handy, whether it's 81 milligrams or 325 milligrams, verify that the patient is not allergic to the aspirin and have them chew it. You want to have the patient stop all physical activity to decrease any further stress on the heart. You want to have them sit down or lay down, slow down their breathing, and keep calm until help arrives. If the patient will lose consciousness, you want to lay them down on a hard surface. That is very important. Many of you are probably aware of Michael Jackson and what happened in his situation, and part of the reason CPR may not have worked on him is because they performed it on a soft surface, which defeats the purpose of CPR. So first and foremost, you want to make sure that you move the patient onto a hard surface. You want to check for a pulse and check for breathing, and if you are trained, then you can begin CPR. If you are not trained, stay with the patient and make sure that you're on the phone with 911 and that you make them aware that the patient has lost consciousness. Knowing these small steps can increase your chance of survival during a heart attack. With heart disease being the #1 killer of men and women in the United States, not one of you does this not affect. Knowing what your risk factors are, what the signs and symptoms of a heart attack can be, and what you can do in an emergency situation can increase the chance of you living through a heart attack. I hope that all of you walk away today with some knowledge of coronary artery disease and heart attacks that you may not have known before. I also hope that by me sharing my personal story with you, that you realize that you are never too young to experience a heart attack, and that it's never too early to begin thinking about your heart health. It's important to think now of what your risk factors are, what they could be in the future, and what you can do about them today. It's important that you take care of yourself before a heart attack attacks you. Thank you.